Welcome everyone back for day 2, and it's great to see you all and have you back with us. What I would like to just do quickly is to review what we went over yesterday, which is our human needs. So there's the spiritual, social, mental, psych, and the physical. And so it's important to look at the whole person when we're meeting with us and to make sure that we actually are able to encounter the whole person. So we are, when we're speaking to them, if they need, that extra hand on the hand, if they're comfortable with that, that's great. Mentally, they're stimulated. Socially, you can involve other people in the meeting as well if you decide to, but just bringing in other people into their life again and making sure that you're encouraging that in their life, that's really key. It's very important. Excuse me. And the spiritual needs. Sometimes occasionally you'll see some people would like to pray with one another and with you, and maybe finishing off the visit with a prayer is a great way to conclude your visits. So just to keep that in mind too, that's really great. Another thing we just want to mention is when we talked yesterday is about the visiting and advice. So that includes things like encouraging you to have a notebook. I have, with us when we meet, we have the training manual in case you need some notes from there, like what we talked about today and yesterday. But we also have, for example, I always like to bring a piece of paper, clipboard, something hard surface to write on. Notes, notes for myself will include, for example, things like what are their favorite things to talk about? Who are the key players in their life? What are the names of their children? Because by saying that, you will actually have a better grasp of the person. You'll have a familiarity with their life, and you'll be able to share on their point in terms of, what things that they like to talk about, which will actually prove to be more beneficial for you and both of you overall. And it's, then we talked about the story and why is my story important? Why do you want to connect people to their history in order to reminisce about their memories? Because as we know, as you get older, you may have more history in your background than you do perhaps in your future in terms of what you think is going to happen in your life. So the excitement already happened, it passed. So now is the time when you can remember those memories, ask them to go back into those memories and to be able to be hope-filled and joyful about what the life they had, and also that they can remember that and to share those memories with you as part of their legacy. And this is really wonderful because the My Story program actually is that it is an enabler to help people come back to a realization about their lives that they haven't maybe necessarily come to close with. They need that closure perhaps, and it also is a time for them to grapple with situations that may have happened that were not comfortable, and you could be part of the healing there, which is really great. All right, so we'll jump right in. And Alex, I think you wanted to share a video, right?
Those who have been part of this before have heard this video, but it's only 2 minutes and 50 seconds, but it looks at the health implications of loneliness.
A new finding from the National Academies of Sciences, Engineering, and Medicine finds that about a quarter of Americans 65 and older are socially isolated, and more than 40% say they feel lonely. COVID-19 has highlighted these issues, especially among seniors, and our Chloe Thibault is here this morning. She's been following this and how much of an effect loneliness can actually have on someone's physical health. Good morning, Chloe.
Hi, Sharon. Good morning. Yeah, research shows that prolonged social isolation and loneliness can have adverse health impacts comparable to smoking 15 cigarettes a day. It's a serious issue that's getting nationwide attention.
Every now and then I miss tactile sensation. I'd like to give somebody a hug.
84-year-old Beverly Kelly says COVID-19 hasn't changed her life much. She just misses her family and wants to hug the people she loves.
That's what gives our life meaning.
Eleanor Rennie is on the same page. She's 80.
I think you have to reach out to other people. Otherwise, you just get so isolated that it's not the way life is supposed to be.
On Thursday, the Senate Aging Committee held a hearing to discuss the importance of social interaction among seniors, especially in light of COVID-19.
If seniors are isolated for a long time and don't have human contact, that they tend to develop serious health problems.
Senator Collins says those problems include an increased risk of stroke, heart disease, Alzheimer's, and depression. When it comes to COVID-19's impact,
it's worsening the health conditions that are caused by prolonged isolation.
that's why seniors are encouraged to reach out if they're experiencing signs of social isolation, like feeling sad or bored, being withdrawn, or not enjoying their life. But the responsibility can't just fall on them.
Family members and friends need to make a special effort to keep in touch with seniors.
Because Mainers are resilient, and sometimes it's hard to ask for help.
I think people just have to realize that it's a time that you should be really good to other people that sometimes you just take for granted.
Now, a committee with the National Academies of Sciences, Engineering, and Medicine has come up with some solutions to address social isolation. Those include improving awareness among the healthcare workforce and the public about social isolation and strengthening ties between the healthcare system and community networks or resources.
Thank you so much, Alex. That's great. That's a great video. And so just, this is really important because social isolation obviously has a big role and has had a huge role, as we know, for the last 2 years since COVID. And as we continue to move through the next kind of, season in the phase of openings and places being opened, visiting is a great opportunity. So I am so eager and excited that all of you are on today. Feel free to jump on video if you're not on video. But for those of you who are, thank you so much. And for day 2, we're going to be focusing today on a number of different things. So I'll be focusing on speaking on this point, which is on communicating with people with disabilities. And then Alex is going to finish off on advocacy at the doctor's office, and then elder abuse and other problems. So really important, very important integral topics that we'll focus on today. And to close off the session, we'll have some questions and answers as well if anyone has any comments. So thank you again. When we're starting off with the communication with persons with disabilities, this is really important because oftentimes what we see is that we don't want to make decisions for others. And this is the main thing, regardless of their ability or inability, whatever it is that they may be coming to the meeting with you with, you want to meet with them where they're at. And so you definitely want to encourage them that you want to have them participate in the activity. So if you happen to do something together, you want to play cards, a game, do some art, play an instrument for them, perhaps ask them first. Obviously, that's very sympathetic, but just common sense, right? And that speaks volumes too, that they know that you acknowledge them, their involvement, and not just like this, kind of a person that has to take whatever it is that we are offering. So it is very involved and important to be keeping them involved. And then when you're speaking, oftentimes we want to ensure that you're speaking directly to the person. So I'm here in front of you as a Zoom meeting, but if we were sitting in person, I would not be speaking to Alex over here and saying, hey, Alex, look at you wouldn't want to do that. You just, obviously, it's common sense. You're very great people. And I emphasize this, that with a person, especially with someone with a disability, you don't want to be speaking to their companion, to their guide, to an aid person, or their sign language interpreter. So if that at all is at a factor and in something that's involved in your meetings, then you don't want to speak to that person or individual. You want to speak directly to the person you're meeting with. Okay, and that's a key point here. Why is that? Because you're there for them. Okay, the interpreter person, whoever the aid is great, but you're actually there solely to meet with this person, and they're enabling that meeting to happen. So you're speaking directly to the person you're meeting with. You don't have to go around that. Okay. With any disability, avoid, obviously, again, a reminder of this point, excuse me, is to avoid any negative, disempowering words. For example, words like victim or sufferer, that has a lot of weight and it's unnecessary. And we don't need to place that on anybody, especially when we're talking about their ability or inability. And, when you're speaking, you definitely want to be sensitive around physical contact. If, for example, they happen to have, a vision, a disability that involves their vision, then you may want to be be not referring to perhaps being blind, but you want to have it reference to, for example, a vision impairment. Okay, so it just depends on the language, right? Because, you know, I'll speaking personally, even my own husband is legally blind, and so I've had it happen where we've been in a situation where sometimes a sleight of word, you know, escapes, and all of a sudden you hear, well, you're blind. Oh, well, he doesn't like necessarily to be told that. And I think that's not something a person who's in that position appreciates, because he's not fully blind. It's, you know, it is part of it, his life. There's a condition there for sure that reduces his vision, but we have to be very sensitive about that. And so we definitely want to encourage people in their abilities. So whatever ability they have and whatever is remaining of their vision, especially, you want to encourage it. So being physical, you know, be sensitive around physical contact too is important. If a person is in a louder area environment, we would love to just move that away from that environment and place them in a place that makes it more conducive to the meeting. Okay, so let's meet in a place that we can hear each other. Putting yourself in an quiet environment is really important. And also keeping this in mind, do unto others as you would have them do unto you. And that's really key and important, obviously, whenever you're meeting with anyone. I have to remind myself this all the time, because my patience threshold has been going lower and lower lately, because as you may know, I have the 4 little ones. And yeah, they're really active. So in terms of people with within a spectrum, for example, like autism and that particular disorder, excuse me, things that we want to avoid include avoid using, for example, sometimes the use of humor is great, but if someone happens to be on the spectrum and you're meeting with them and you're speaking, humor, sarcasm, figures of speech, or colloquialisms may not be as beneficial to your conversations. Now, the key reason being is that people may not understand them. They may not pick up on what you're saying. And then it creates an awkwardness. And then you have to explain it, which I'm not great at, and I don't hope anyone else has to really go through. So sometimes it's easier to avoid those things and just speak in short, simple sentences, be to the point. Being polite, obviously, is important. And then making sure that if, for example, if you know that there isn't a phrase or word that you catch that they don't understand, just ask them and say, oh, do you know what I mean by this? And then if not, then you can, you know, you can clarify. Something that oftentimes we don't notice is our bad body language. So I often have a bad posture and I need to fix that a lot. So I'll correct myself a lot. And I notice some people do it too. And the minute you mention it, it's like, oh, we just shoot up, right? But it is important to be attentive. I find it's important to engage as well, to be upright. And so often by you straightening yourself out and actually not acknowledging it, or lack of, the person in front of you will do the same. And that actually automatically gets a boost in terms of energy. People will actually become happier just being reminded of something that's so important, that's so simple. So just having your body language, showing the person that you're attentive to them, you're engaged in them, you're dynamic, you know, you might want to use your hands if that's who you are. But if not, either way, you are actually showing them that you care by your body, even more so than what you are speaking. So it's important to show that a lot. Okay. And of course, it's just a short time. So whenever you do meet with someone, giving that all your energy is so important, so vital. Excuse me. When we speak, we want to use flexible words. And what that means is instead of, for example, we may complete this task, instead of we will, or we may not necessarily be able to finish this. Just because by being saying things like may instead of not, you're actually sharing that there is a possibility they may not successfully happen, or that you may not come to completion with something. And that might be off-putting for them, but at the same time, you're covering yourself that, you know, things change, plans change all the time. And we want to encourage that person. And if something doesn't happen today, then okay, that's fine. You know, I know we're not kids here, but I know after my own children, they will get really disappointed if they realize that we're not going to do something that we say we're going to do. So keeping that in mind is really helpful, I think, for our elderlies, people as well, that we are speaking with, because maybe they were looking forward to something and it just may not happen. So that's really good too, to know that. But if you are speaking with someone who happens to be elderly and, you know, For example, when we're visiting with someone, you may experience that they've had a stroke in their past, and that may actually lead to symptoms that appear like autism. So just keeping that in mind as well, that they're not actually autistic, but they are actually encountering symptoms of the stroke, and that's displaying itself as symptoms of what you would think is autism. Okay, so just something to keep in mind. Now, when you're speaking with people with chronic medical conditions, these include, things that you may not know, for example, that a person is having a condition. So something that might be very underlying the surface, they will not maybe disclose certain things to you, and they don't have to. That's no one's business, right? And it's their own medical history. So they may and may not necessarily communicate any differently. And so if a person is showing signs of distress or being unwell, if something chronic does show up, then just keep calm, use an unhurried tone, and just very level and neutral, and don't be too aggressive or coming off too strongly. But ultimately what you want to do is ask them if there's anything they need, if there is anything you can do to help that person. If you don't know what to do, you can access support, contact their caregiver, go to speak to their aired person if they have one, or if there is a nursing station, maybe go and attend there and see if there is someone that can support you. But ultimately always tell them what you're doing so that they don't come off surprised that something is happening, and always share that with them first, okay? When you're speaking with someone who may have a hearing difficulty, this I find is important because I feel like I have a hearing difficulty. I often talk to my husband and I have to ask him, increase the volume, please, because he likes to speak very low. The tone is very even. So there's very little distinguishing, words that I hear sometimes even at all. So I have to always emphasize, please speak up. If you think a person can't hear you, or if you have trouble actually understanding the speech of a person, who may be deaf or hard of hearing, let them know. Simple, I guess, just logical things that to keep in mind. You may not understand one or two things they say, but it's integral in what they're going to say next. So you definitely want to make sure, oh, so I'm hearing that you're saying that, Bob really appreciated that you gave him that gift last time you saw him, right? Okay, great. That's fantastic. So just to reconnect with them again, and they'll love that because you're acknowledging what they've already said. And if you said it right, then obviously that makes them feel great, feel better. If a person has or uses a sign language interpreter, look directly at the person who is, perhaps deaf, and maintain eye contact with the person who is actually hard of hearing. Don't keep going back and forth to the next person who's interpreting. And you want to talk directly to the person, of course, not the interpreter. In terms of rephrasing, this is key here. You want to always come back to the sentence, whoever is speaking, that, if you don't understand, just rephrase the sentence and see if that helps with the situation. Because again, hearing difficulties are they can be very problematic for communication, of course, I'm sure you know. So my own father, for example, has very hard of hearing. He's lost 70% of hearing in one ear, and the other ear is quite still good. So you have to know which side to talk to him on. And sometimes I forget, so he reminds me oftentimes. And if you're in church, you get you notice that really quick. You want to talk, and it's you may not hear each other. So it's important to understand where your person, whoever you're meeting with, is coming from. And when you are speaking, you want to face the person when you're talking to. Don't sit in front of the light. We have a light right here in front of me. But oftentimes, if I'm sitting with my back to the light, that's going to be really strong in your face. So what we want to make sure is that you are having every opportunity to be seen by the person you're meeting with, and they can see your mouth and your lips. And if there is an issue, for example, if someone's has other difficulties, that you can speak clearly and they can see you. So always just move away from the light source and just reconvene in another area that is better and more conducive for your meeting. Now, in terms of continuing on here, if you happen to a person that's meeting with you, if they need to read lips, again, that's a really important point to make sure that's visible. And when you're visiting, you want to ensure that, be careful with the masks in that sense, because they may obstruct that vision and they may not hear or see your lips at that point. So just be aware of that, because that can make a difference as well. And then in terms of, when you're speaking, oftentimes people who have hearing loss, they count on watching people's lips. So that's the other point just to keep in mind. And to help them understand what you're saying, avoid chewing gum or obscuring your mouth with your hand while speaking. Don't yell. My dad often, because he is hard of hearing, he likes to raise his voice, but don't take it the wrong way because that's often maybe off-putting, but it's not to offend you. It's just because they can't hear. So they're going to raise their voice to think that you can do the same. And when you encounter, excuse me, a person with a learning disability, which is the slide here, we want to ensure that you are able to ensure communication is easy and swift. So use short, clear, direct sentences. This will help you by having them understand you completely. And if you need to rephrase that information, older people may have an acquired learning disability. And this happens because after a while, you have certain conditions that actually can grow to that point where that person actually has an acquired learning disability. And so for yourself, and when you're encountering this, you may not realize it as quickly, but this actually becomes an issue for a lot of people when they're meeting. And so you want to be very, very just flexible in your approach. So bringing that extra clipboard, paper, pen, you may want to actually draw a picture of something what you're describing. Consider visual aids. Like I said, bringing a book into that dynamic is really great. You can show them things. So when you know that there might be an issue in understanding or cognition, you can actually show them visuals. And things like diagrams and pictures are very helpful because they put across the point that you may not necessarily be able to establish or make with your words. So we want to encourage you in that way as much as you can. And always, always provide opportunities to answer any questions. So if you think they might be curious or they look frustrated, then let's bring that up. What are you thinking right now? What are your thoughts? I do that a lot. I think I put people off sometimes because I just say, so what's going through your mind? Be prepared for the answer. All right. So with a person with a mental illness, this is something wherein often you may not even know they have a mental illness and they won't need to communicate it to you any differently, but ultimately you may pick up on it later on. And it's something that kind of slowly sneaks up on that conversation or maybe in the process of your meetings. And if a person shows signs of agitation, anxiety, panic, fear, disorientation, aggressiveness, this is something you want to keep in mind, okay? Always remain calm. Don't let yourself get ahead of your meeting and in that encounter. And don't be scared because this is their reality. You want to allow the person to talk through this, let them share that time with you, but ultimately keep your voice unhurried so that you're able to really be that foundation of that meeting because you are that base, you're that rock, okay? They can be stable knowing you're there and they can trust you. So that's really important. And then making time to allow the person to talk through that is very key here. Showing empathy. So for example, without necessarily agreeing with what is being said, you can say statements like, I understand that you are feeling this. I understand that you're feeling worried or anxious, upset, whatever it is that you want to say. And accept that hallucinations and delusions are real for that person. So again, these are not your reality. It's not what you're encountering. You don't have to pretend like you're in the room with them with that other thing or whatever it is. But it's with a person which might have this mental illness, with that disability, but don't pretend they're real for you, okay? And again, using short, clear sentences. And if you need help or support, definitely reach out for that and access it. And then you always tell them what you're doing. Always inform and make sure that they acknowledge that you know that you're bringing someone else that can assist them with this, okay? Now, people with mobility issues, this is the next point here. Oftentimes, people may have a need related to their mobility. For example, a person with a respiratory or a heart condition may have trouble walking long distances. So we want to ensure that you're aware that, we're pretty quick walkers, me and my husband, and we go toe to toe, but he's always faster than me, always. And that's on a good day. And then lately I've been having something plantar fasciitis happening. So that's just preventing my walking altogether. So when we are in, like, and I know Alex will talk, he knows this because he's a runner, but if you're a fast-paced person, you may need to slow down sometimes for the people that you're meeting with. And if they like to walk and they might want to slow kind of stroll, and that's great. We can do that with them, right? So keeping that in mind, you might be the only walk they have even. So when you do meet with someone, you are encouraging that in them. They might be really positive and receptive to it because you're the only opportunity they get to go out with. So just keep that in mind too, in your pocket. That's a great tool to have to be able to walk around if you're able to with them. But if they're not, and that's a real issue, referring to the wheelchair is important here. And always the way you come across to that item is important. So for example, never moving that item for them without their permission first and asking if you need to. If you don't need to, don't worry about it. But otherwise, if you need to, you want to make sure you ask their permission first. And if you're speaking to them about that, you want to say person who uses a wheelchair, or rather than confined to a wheelchair or wheelchair bound. Okay, those are those very those are disempowering words. We don't want to use those. And the wheelchair is also just something that for your own self, that it's something that enables them to walk around and be mobile. So it's actually a positive thing. So we want to refer to that wheelchair as in a positive manner. And when a person who's able to get around and participate in society, it's actually liberating. It's not confining at all, the chair. So that's why this is something positive we want to acknowledge. And so when talking to a person in a wheelchair, you want to actually take a chair that you can sit on beside them. And so that way you're at the same level. Okay, so just to keep that in mind as well. And so you're at their eyesight, and also if it's not possible, standing at a slight distance so that they aren't straining their neck. Okay, to look up at you is also important. So if they're sitting in the chair, you don't have to look like this all this time. Be aware of a person's reach limits too, because they happen to be using a wheelchair. You want to ensure that if they need an item and you're noticing that they want to get to that teacup or that radio or that TV or something that's beside them, they can't reach. Hey, do you mind if I reach this for you? Okay, I'll pass it over. And place as many items as possible within their grasp. Okay, that's really, really complimentary. And then if you need to, you can always wipe them after if they're concerned about anything, but you can always help in any way you think is important, okay? And of course, don't push or touch a wheelchair at all. It's their property. So think of it as a purse for the ladies. And then for the men, it's like your wallet. It's your device. It's your personal space. So please don't touch it without their permission. And yeah, that's good. And moving on here, we have people, when we're speaking with someone who has a speech difficulty, don't assume that they can't understand you. Always continue to speak and make your words the same as you would as if you didn't think they had a speech difficulty, because they can understand your speech, okay? So that will be impacted by how you speak. It's their speech that might be impacting, right? Their communication. So just know they can hear you, they can understand you, but it's their difficulty maybe in that regard. So you have just being patient here is really key. Don't interrupt, obviously, or finish the person's sentences. This is another one of my things I had to really get over myself, because I still love finishing for people. And I didn't want to do that as I realized when I met with other people more. So this is not a great habit to have. So definitely letting that go. And if you can, ask questions, that require short answers. So for example, if you know that they might have an issue with speaking, then, did you have a good day today? Yes. No, that's all you really want to hear, and maybe all they want to say. Do you like this drink, or would you like this beverage? That type of thing. Just being very short to the point. Being also very attentive. We don't want to pretend to understand what they're saying. If you don't understand, don't pretend, and just simply say it, and give them your full attention, because it's important that they know they can really trust in you to be honest, genuine, and completely transparent. So this is important too, that they understand how you're being with them will actually help them be more of themselves, and they're accepted. And that's a form of love. So when you accept someone fully and you don't want any conditions attached to that, they actually feel love. Okay. And then also be open to different ways of communicating. if, for example, after trying, you still can't understand the person, ask them to write it down. Like use that clipboard, use the paper, pen and whatever, and just ask them to write it down or suggest another way of facilitating communication. Because, I think Alex spoke about this once. He has a cousin who happens to be deaf. And they write off everything down, and they often will write it down because of that reason. And it's a great way to communicate. You can talk a lot about that, and I'm sure he'll touch on that later as well. So, and then if you happen to have a meeting with a person who has a visual difficulty, this one hits home because, as you know, my husband, and identifying yourself is really important. If it's on your first encounter and your first introduction to that person, you want to make sure that you are in a place where they can see you well, and also just identifying who you are. So, hi, my name is Kathy Matuzzi Acosta. I'm here to meet with Irene. I look forward to our meeting today, and just so they know who you are, because for oftentimes, even myself, if I don't wear my glasses, I can see a face, but I don't see actual details. And it's good to know every time when you come back into that situation and you're meeting with them again, that they know who you are, which person, that it's you. And if you see that they have a guide dog, walk on the opposite side. If you're going out to walk with them and the dog is coming along, just make sure if it's yourself and them, and the dog is on that side, then you're on the opposite side of the dog. Okay. You're not there for the dog. And I know they're great. I love golden retrievers. We were actually talking about that recently with my husband, and it's a great thing to have. And it's not often that you see. So if you do happen to see it, it's a person who doesn't necessarily need as much help or support, but someone who can manage a dog. So that's something to keep in mind too. They want the dog there. And don't ever touch the dog. Just please, because the dog is working and they need to concentrate on their work. So it's not really a casual kind of play. It's just a working dog. And then also if you're walking, feel free to describe what you're doing or seeing. So when we go out, oftentimes we went to Simcoe Fair this week, past Monday. It was a great time. And but there's a lot of things that I could notice that maybe my husband doesn't notice. So I would often encourage and say, hey, look at that over there. That's something you want to avoid. Like make sure our daughter doesn't see that. It's kind of scary. Or over here, this is really beautiful. Look at that sunset. Just different things. Or I noticed there was actually a cousin in the group that he noticed that he knows. And so I brought it up, and then I noticed he noticed him as well. So I was happy that they noticed each other. And so when, for example, we're speaking, we may want to say something like, oh, watch out for that crack in the sidewalk, or watch out for this on the floor there, because it could be in their way, or might be something that might hurt them. Also, giving specific non-visual information is very good. So for example, if you're giving directions, give specific details, listen for detail, because oftentimes people who have a visual difficulty will actually really be detail oriented. And you'll notice this, they want to know exactly what you mean or exactly where you put something, because if they can't find it, that's an issue. So you want to ensure that you have that detail in mind. Okay. And also when you are speaking, offer to read for them. If they have a book, or they want to read something, or they want to learn about something, feel free to read for them. That's a great way to share that time together. And I'm sure they'd appreciate it as well. And if it is written, you are giving that added value, because you're doing something that, they would try to, they would love for you to do. And if you happen to be serving food or sitting with a person eating and they happen to be blind, letting them know where on the plate certain things are. Like if there is a garnish, maybe you want to ask them, would you like to remove the garnish? You have a piece there, and anything that is not edible from the plate, you may want to encourage to remove that. Okay, just a consideration. Also too, you can describe things like, oh, you have a piece of steak in front of you, it's at 1200, 12 o'clock, and then you've got a piece of salad, some salad on at 3 o'clock, just things like that to keep in mind, that you can use that specific detail so they would appreciate to know exactly what you mean. And often if you need to leave a person who happens to be having an issue with, like, they have a visual issue, inform that you're leaving and ask if they need anything before you leave, because maybe they wanted you to read that mail that came in the other day, or fill in a form, or perhaps, turn something on or off, or set something up for them that they might want to do. So, and if a person who has low vision may need written material, and they need you to print something for them, make sure you do the bigger fonts, because the large print really makes a big difference. You want to go big, okay? So especially if you know their vision is an issue, you want to go at least, size like 18, 20 more, plus. My husband has to magnify it to 400% or even more sometimes. So the letters need to be big. And provide that print for them. That's really considerate. And as people age, their vision changes. So keep that in mind too, that vision will be impacted as they get older. And so it's important to keep that. And of course, in this book that you have with us, the training manual, at the bottom, you're going to see this, we're on this last page here of this section. There's actually appendixes in this training manual, which are really helpful. And we haven't mentioned this yet, but for example, you could read more on this, and this would be very important and very invaluable, is A Way with Words on page 45, complex communication needs, and then the 10 commandments of etiquette for communicating with people with disabilities. That's really great too. So that's in the books as well, the training manual that you'll receive if you haven't already. So that concludes my segment for tonight, and I will pass it along to Alex. Thanks, Alex.
Thank you very much. So I'm going to be talking about advocacy. Now we have developed an advocacy program, and I believe the first advocacy training session that we'll be offering is on it looks like possibly November 10th. So we'll see if that ends up being the date, but it looks like that's probably the date for our first advocacy training session. The idea of advocacy is that a lot of people, especially people who have significant health problems, really should have someone go with them to medical appointments, etc., to be a patient advocate for them, whether they be a friend or whether they be someone who's visiting. Now, advocacy is not meant for everyone. It takes a certain type of a personality, a certain type of a person who has a type of a character to do this. So for instance, someone might, to be an advocate, someone might need someone to help them because they have troubles stating their feelings about their physical pain. To being an advocate, you have to get to know that person. You talk to that person. You find out what are the issues with that person, and you then help them speak out, because they might be afraid of speaking out themselves. You become an advocate for them. They might have a lack of understanding. Often you might have somebody who, in a family where their grandparents or their parents were born in another country and they don't speak English well. You'll often have a child or someone be a patient advocate for them, because of course that child or a close friend speaks English much better. But even here, when we're talking about advocacy, someone might have a hard time communicating or being understood, or they might be too ill to speak up. So what happens is that we recognize, and I tell people about this with advocacy, that how a doctor perceives somebody does not mean that this doctor is a terrible person or anything, but a doctor will perceive someone differently compared to how you might perceive them, because the doctor might not know them. So for instance, really know them. So for instance, if someone is as an example, in their 80s and they're going to the doctor with some health issues, often a doctor is thinking, well, what am I going to do? What are you going to do for this person? They're in their 80s. Unless it's something serious that they can actually deal with, often they'll be thinking of some sort of analgesics. They might not even bother properly examining that person. And as I say, again, it's not because the doctor is a terrible person. It's because there's sort of a different level of viewing this. In the same way, people with disabilities are complaining about this all the time. We've been seeing a lot of euthanasia lately of people with disabilities who say they've battled for years to get medical treatment unsuccessfully, and therefore they were able to get approved for euthanasia from aid, but they can't seem to get medical treatment. There's a woman who I've been communicating with who's in British Columbia, and she has a degenerative condition, and so she needs surgery to be able to have her neck. I would just say, because her neck is sort of she has a degeneration in her neck right here, and it's a degenerative condition, but she needs to have that solidified, because obviously having her neck move around is painful, and she hasn't been able to get it, even though others who have the same condition have had the surgery. And I was talking to her over Twitter. We're going back and forth, and she then says to me, I think, Alex, my problem is that I'm also autistic, and the doctors don't understand me in the same way as they might understand someone who's not autistic, because I don't react the same way as other people. And as somebody who has an autistic son, I understood that right off the bat. Obviously speaking, my goal was to speak to her and convince her not to die by lethal injection, but in fact to continue to seek medical treatment. So we move on. So what is an advocate? Who is an advocate? What does an advocate do? A support person can help that person. So you're someone who's actually helping them. You're not actually representing yourself at all. In fact, that's the last thing you're doing. You're representing that person. You're helping them receive what they need. You're helping them stand up for their rights, to obtain and maintain their opportunities, to gain access to support service, and talk with healthcare providers. Now, let me tell you something. It's interesting. I mentioned to you I have a son who's autistic, and over the years, my wife has done a ton of work to make sure that my son has the supports that he needs. What's very interesting about that is that a lot of people who have a child with autism or other disabling conditions aren't aware of all the supports that exist for their child or for their adult child. And it's funny how we'll often be visiting somebody and they'll have, let's say, a son or a daughter who's like 22 years old or whatever the age might be. And we'll say, oh, have you received this benefit? They don't know what you're talking about. So, it's interesting because my wife, in a sense, then becomes an advocate because she then helps them get the services that do exist. It's a crazy situation where unless you actually have that service and know of the service and know how to get that service, you may never have heard about it. And that's sort of a crazy thing in Canada that it's like that. I'll say another thing. None of those services, this is just a comment. This is just a comment. You can write it down. Almost none of those services can be obtained by a person with a disability who's autistic. Like my son, he has these services, but if you were to ask him to have to go through the hoop in order to qualify, he can't do that. He couldn't do that for. It's not that he's not. He doesn't qualify. He does qualify. It's just that if you're going to ask him to do it, with his how would you say how he communicates with people and how he reacts to people, it just would never have happened. So I just sort of think of these things and think of how the system is and sort of wonder. Nonetheless, a person who's doing advocacy is helping that person receive the services that they need, and everything is completely confidential because obviously you're not doing this on your behalf. You're doing this on the behalf of the other person. Everything is completely confidential. How to be a good advocate? You must be a good communicator and ask questions and be a good listener, be courteous and respectful, and be assertive. When I'm talking to people about, for instance, we get phone calls all the time, and Kathy could talk about that, and they're going through difficulty obtaining medical treatment, or they're dealing with a family member or a friend or somebody, and these are sometimes very difficult issues. I'm always telling them the same thing. I'm going through the information, and it's the same idea of being a good advocate. You must be straightforward. You must speak clearly to people. You must be very courteous and respectful, sometimes even to the point where it's painful, and you must be assertive. So if you're going to be assertive and rude, I guarantee you're going to get nowhere. In fact, you'll probably get kicked out. They're probably not going to want anything to do with you. But if you're going to be assertive, but very, very respectful and very, very courteous, even to the point where, as I say, it could be painful for you because maybe you're not feeling like they're treating you the same way. The point is that you will then be effective. And this is very important. Asking questions is very important also as an advocate, because the point of it is that you're trying to help this person. Sometimes it's the questions that are bringing out the answers that are needed for that person. And that's very important. We move on. Discuss expectations. So we must arrange consent ahead of time. So this is information is in your book, obviously. When you're an advocate, you do not act on behalf of somebody without their consent. Obviously, you're there for them. That's what you're doing. You discuss expectations. So let's say someone's having certain health problems and they're having a hard time receiving the treatment that they need. They don't seem to be able to communicate effectively with their doctor. So you're going in there and you would say, you have to understand that my friend here, let's say it's my son. My son is autistic. And let's say he were having health problems. The fact of it is it would be hard for my son to communicate with the physician effectively not because he doesn't know how to speak. That's because of the fact that he does react and say things in a different way than would be expected by the physician for someone in that condition. So what would be helpful is that they would have an advocate. Well, it's the same thing when someone has a little bit of early dementia. They have a bit of dementia, they're having a hard time communicating, they're having a hard time expressing themselves, and you're then helping that person receive the care that they need. Now, a lot of people have done this for their mother or their father, right? They've done this, they've gone to the doctors for their mother or the father, and their father or their grandparents. In this case, you're doing it for somebody else. You must complete the patient advocacy agreement because obviously speaking, you cannot be representing somebody without them agreeing to you being there. Absolutely. We go on to the next. Advocates, well, we talk with the person and we support them and we act on behalf of their instructions. So this could be difficult. So obviously speaking, when you're being an advocate, you want to possibly be an advocate for someone who you share their values, because if they're asking for something that you would not agree with, maybe, just maybe, you won't be the best advocate for them because you'll feel uncomfortable because you're there not on behalf of yourself. Now, of course, before the meeting with the doctor, you could talk to them and say, well, really, do you think that's a good idea? You can speak to them that way, obviously, and if they trust you, obviously they might agree with you. But nonetheless, the point of it is that you're acting on their behalf, not on your behalf. You act as if they're, so with the healthcare proxy is different than an advocate. So that's the other thing. Now, the Euthanasia Prevention Coalition, we have what you call a healthcare proxy or a power of attorney type agreement that we do sell to people for only $10. And I do advise you to get that document if you don't have it already. And you can just email me at info@epcc.ca and I'll send it to you. And it's only $10. It's pretty cheap. But the point of it is that is different than being an advocate. The idea of the healthcare proxy is that you are representing somebody when they are unable to represent themselves, meaning they're unable to communicate, they've become incompetent. So in the case of a power of attorney or a healthcare directive or a healthcare proxy, those documents come into place when you're incapable of speaking for yourself, whereas an advocate is there even when that person is capable of speaking for themselves, but you're acting on their behalf to help them. And we move on. Before the visit, well, like any of these things like visiting somebody, the same idea is for advocacy. We must know, of course, the time of day, and we must gather information. So let's say it's going to be a doctor's visit and the person's having some difficulty, whether it be pains in a certain part of their body, whether it be that they're having a hard time with certain other health issues. It doesn't matter. You must gather the information with them. You should bring a list of medicines. Now, why do we bring a list of medicines? Because obviously the doctor should know exactly what that person is receiving. The doctor might know that already, but nonetheless, sometimes someone is receiving 10 or 12 different medications, and they came in with this health problem, and they had this health problem, and they had that health problem, and each time they got a different prescription. And by the time you start putting it all together, you realize, well, drug A actually is a contraindication to drug B, and they probably shouldn't be taken together. So sometimes the health problem is related to the fact of the drugs that are being received. I'll give you an example. My wife was visiting somebody and this person was like literally sleeping all of the time. They thought this person was on death's door. And what happened is then there was a bit of a question about the medications that this person was receiving. And they did a little review of that. And lo and behold, they changed the medications they were receiving and the person came to and went home. Very interesting. I'm not saying that happens all the time. This isn't the same as Jesus resurrecting from the dead. It's not the same idea. It's about the fact that there were certain drugs that should not have been taken together. They just shouldn't have been doing that. And not always are these things being looked at. And I'm not saying people are stupid. I'm not saying people are mean and cruel or lazy. What I'm saying is sometimes they just don't look at it unless you actually bring it and show them this is the list of medications certain a person is getting. And then they say, oh, maybe that's not a good idea. You inform the doctor's office of your role. So if you have a legal agreement that you've written, and I've said we have to do that, the document for the legal agreement's in the booklet. So it's right there. It's on in Appendix G in the booklet. You can use something different, but that's a set document that can be used. You would have that document and be prepared if there's a delay. Now, when has that happened before, that you go to a doctor's office and there's a delay? I don't know. I don't know if that's ever happened before. Nonetheless, be prepared. We go on. What do we need to accomplish? And this is the difficult thing. So you're helping someone, and as I say, it's often possible that this person has several health problems, but they might also have some levels of early dementia. They might have, memory issues, etc. They might have other issues that are causing them to have a difficulty communicating for themselves. So then as an advocate, you're helping them. But you need to know what the person's concerns are. Is there any new concerns? You know, what are the expected outcomes? Well, you need to discuss this with the person ahead of time. You can't be an advocate and represent their wishes if you don't know what the issue is, right? So you need to sit down with someone and talk about these things. Do they want to discuss new symptoms? Are there new symptoms? Are there new concerns? Are there new things happening? How do you talk with a doctor about sensitive issues? This is very important because someone might have some very sensitive issues. You're their advocate, so then these conversations come up. Once again, when you're talking about somebody else's issues, we're talking about their private concerns, but at the same time, they might need you to express that for them to say, Kathy has told me that there's this and that going on, and we're just thinking that maybe you should be looking at that. Your presence may be support enough. That's another thing about advocacy. Sometimes someone can speak for themselves, but they really do need somebody there with them. Sometimes that will be enough. You keep a note book or a journal. Now, this is a very important issue. Once again, that notebook or journal is not yours. You're keeping a notebook or journal when you're doing this for what purpose? To help out the person you're advocating for. That is their information. You might be keeping the notes to help them. So let's say it's someone who has some level of dementia. It's important that you kept the notebook or the journal because the doctor might be saying A, B, or C, but the person who has some issues of memory can't remember everything the doctor has said, or maybe 3 or 4 days later can't remember much of anything of that meeting. But it's important that you have that information for them, right? That's very, very important. Record particulars. Keep a folder of written responses. And as I said, remember, this information is completely confidential. You're doing this for that person. You're not doing it for yourself. This is something that you wouldn't share with anybody unless there's something specific that has to be shared. But even then, it's still that person's information. You might ask somebody, can I share this with your son or daughter? That's possible, but that's a whole totally different issue. And we move on. You take notes and you respect that person's privacy, but and when you're in the meeting, you have to ask questions. It's possible that this person wants you there because they're not good at asking questions. They're not good at being assertive themselves, right? You can't be intimidated. So if you're the type that gets intimidated, you're not going to be a good advocate. Maybe you'll just say, I might just be there to hold someone's hand, but I can't do much more than that. You must suggest and provide some answers. You inquire about different services. So let's say someone's having difficulty with their mobility and they've got some health issues and they need some help in their home. Well, I guarantee you the physician is the gatekeeper for those services. So if that person needs some services at home and those services exist, even if they're only existing, let's say 2 hours a week or something like that, or whatever they're able to get, the gatekeeper for that service is usually the physician. Okay, the physician writes a note saying, I had a meeting with my patient. My patient's going through A, B, and C. Really needs some help with, receiving a shower once or twice a week, and this is kind of thing, right? You know what I'm saying? Ask for information sheets. Well, guess what? Doctors have information sheets. Nurse practitioners have information sheets. Ask for this. Why? Because it's important to help explain it to the person who you're helping out. Make follow-up appointments. So the doctor might say, well, I'm going to see you. I need to see you again next month. Fine. Then you go and you help them make that appointment for next month. Remember, often you're dealing with someone who has some level of dementia or issues of memory, and that's why it's so important that you're there for them. You've helped them fill any prescriptions. Once again, also, as we said earlier about checking the drugs that people are receiving, pharmacists are very good at that today. And pharmacists actually want to be seen as a higher level of professional than they were seen as in the past, and they have a greater expertise in this level of drugs than maybe even some of the physicians have. I'm not knocking the physician. I mean, just the pharmacist, that's their expertise, right? So sometimes when you're going to fill a prescription, you might want to keep the list of the prescriptions that this person already has with you, in order for the pharmacist to look at it and say, well, maybe that's not a good idea. Maybe, I should be talking to the physician and the prescription should be this. The pharmacist might know that, and or might just give you a funny look saying, why are you getting that prescription when you're already getting this? Discuss the appointment with the person. Well, obviously speaking, that person, if you have a follow-up appointment, you need to discuss the appointment. And as an advocate, you are invaluable in helping to make the world a better place for those in need. Now, let me tell you, advocacy is really, really important, not only for the elderly, for your mother or your father who might be very elderly, not only for them, but what about people with disabilities? Somebody with a disability might not be that old. They might be very, very, an intelligent person, um, and yet they should have an advocate. Why is that? Is it because that no? What it is that you are seen differently when you visit a doctor with a friend, whether it be your daughter, your son, or somebody else who's there with you, because then you are what? You're part of a community, right? You are part of something. So the point is that when you're visiting the physician and you have somebody with you, and let's say you have healthcare issues like people with disabilities, you are seen as a greater level of importance or care, not because you're any different than you were before, but because there's somebody with you who really cares about you and is with you. That doesn't seem like it should be that way. Sorry, it is. Yeah, we are perceived in community. And even, a good doctor might say, oh, I will never see someone differently. And da, da, da. Well, on a busy day, when you come in there at 2:30 in the afternoon and they've already seen 20 patients or 30 patients, however it might be, and you're coming in, and what's the doctor thinking? Holy camole, a little bit of analgesic might just help this case, and on we go. I'm not judging. I'm just saying, it's a tough life being a physician, even a great physician. Okay. Advocates code of conduct. I will practice with compassion and respect for the person whom I work for or whom I work with. My primary commitments are to promote the health, safety, and right of that person. I will be transparent in my work with the person. I will maintain privacy on behalf of the person and keep confidential all activities and records, unless speaking with my supervisor for advice. Well, even then you would speak to the person who you're representing to say that, can I ask my supervisor about this? We move on. I will guide and assist the person in medical decision making, but at no time will I make decisions about the health or medical care or medical services on their behalf. It's difficult, Sometimes you might not agree, and obviously we believe in respecting human life, but we also recognize that we have to respect one's privacy. You have the right to say no to medical treatment, whether I like it or not. You have the right to say no to medical treatment. I will respect the person's values and belief system as the foundation for their decision making. And we move on. There's a nice little image. Elder abuse. Well, I don't like discussing elder abuse, but we have to discuss elder abuse. We have to discuss elder abuse because you might actually, whether you know it or not, know people or be visiting someone who has experienced abuse. Abuse has become far more common than we would like to discuss and like to acknowledge. I'm not saying that if you're visiting a group of people, let's say you're doing visiting for a church community, and you actually have known this person for years, but you might not have seen them in the last few years because they may have lost some level of mobility, but you knew them from the before. So you know them as, Mary or Jane or so-and-so, you know them, right? You have some knowledge of them, and you're visiting them on behalf of this church group, and suddenly you're noticing things. So it's something that we can't be silent on, and we have to discuss. And it's not a nice thing to discuss. Maybe I don't have to go through everything, but I will go through everything about this, because the fact of it is there's lots of signs of abuse. And remember, someone, you might look at and say to someone who, let's say they have several bruises that seem to be somewhat significant, and you might be thinking, how did they get those bruises? But you're visiting them for the first time. You might, go around asking some questions, and they might say, oh, well, I fell, or da 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 da. But then you come 2 weeks later or a week later and you're visiting, then they have more bruises. Either there's a health problem or there's abuse going on. And then, bruises are different even. What about if they start talking about, let's get into this. Signs of abuse, sores or injuries. Um, they're always saying they fell. This is really an implausible reason for the injury. They're not seeking care for their injury. Like honestly, if you're an 82-year-old woman and you have a serious injury, you're going to go to the doctor or the emergency with that serious injury. But if you decide not to go to the doctor or emergency with your serious injury, then obviously speaking, it's because you're not going for another reason, right? Sadly to say, right? So you're talking to somebody and they don't seem to seek care for their injuries. You have to start wondering what's going on. They're messy and unclean in appearance. Well, what happens when people are experiencing abuse? They also lose their feeling of self-respect. Maybe somebody always dressed nice, always, and now their son's living with them. I'm just using a son as an example, nothing personal, okay, guys? But nonetheless, now their son's living with them and they seem to not be the same, okay? Malnutrition, weight loss. Someone saying also, well, I have no money at all. Yet, you know that so-and-so, they had a fairly good life. And now you're wondering they have no money at all, none whatsoever. And they don't have groceries, they don't have, they are experiencing dehydration. Well, dehydration happens for several reasons, and I think that Kathy mentioned earlier that when you get older, the body doesn't, you don't have as much fluid in the body, and you don't deal with fluid in the same way in the body. The body, I would just say, changes its needs, etc., as you become older. Nonetheless, someone who's dehydrated, this is usually because of neglect, okay? They're afraid of someone. You go over to, put your hand out to shake their hand and they jump back a bit. Well, that's a sign. That's a clear sign. Financial fraud. Well, financial fraud is becoming ridiculously common. Not only from family, it technically has always been a crime that was more often related to family or friends. But now you're getting all these professional fraudsters, and they're taking people. Basically, it's terrible what's happening to people because they have a professional way of getting your confidence, and then they take your money. And you don't realize at first because you're thinking, oh, they're telling you, oh, it's your granddaughter who's needing to have money because she got stuck in Taiwan or something, and you're thinking, my granddaughter's in Taiwan, but they really seem to know their story. I'm maybe that's an exaggeration, but I'm getting to. They're professional fraudsters, and this is really going on now. How about exploitation and sexual abuse? Financial fraud actually is definitely the crime right now that is so prevalent. Physical abuse is an act of violence that may result in pain, injury, impairment, or disease. Neglect is the failure to provide the goods or services necessary for functioning or to avoid harm. As I said to you, like someone who's experiencing dehydration, it might mean neglect. I often talk about the problem during COVID of those people who died in nursing homes, and often those deaths were neglect. Now, there might have been an excuse for the neglect. I don't buy it nonetheless. I don't buy it for a second. That's not the point. The point of their excuse might have been, oh, we didn't have staff. Everyone was afraid of getting sick. They all weren't, there was nobody here. Excuse me, but you're putting, you have the care of these people, and, that should be your priority. Somehow you have to make sure you're caring for the people who are living in your institution. I'm not a big, as I said last night, I'm not a big supporter of institutional care. I recognize that it's necessary in certain circumstances, but I would really encourage people to stay in their homes as long as possible. And if I had any say at all within our government system, we'd be encouraging ways of providing care for people in their homes and keeping them in their communities. Elder abuse, doctor or healthcare provider is not notified. If the doctor is not being notified of an injury, that's a big sign. They have a smelly wound. What does that mean? That means they have an infection. Okay. Why did they not go to the doctor when they're having an infection? Because obviously it's painful. There's no question about it. But usually it's because there's another reason why they're not receiving the care they need. And that's how you start identifying there's abuse going on. The person has not received any medical care. As I've already said, if you visited someone just once and there's some bruising or there's some issues, you might be concerned, but you're thinking, well, But when you go the second time, or the third time, and that you can't remain silent. You just can't be silent about these things. Most common injuries are bruises, pressure sores, and fractures. Now, bruises, of course, can happen in, there are rupturing of the blood vessels and things like that. Pressure sores are very concerning, and I think we get into that in the next slide about bruises and pressure sores. Okay, so abrasions, superficial injuries involving the outer layer of the skin. They're caused by the movement of the skin over a rough surface. So, it's evident in both physical abuse and neglect. Bruises happen when a blood vessel ruptures and blood escapes into the surrounding tissue. So you see the bruising going on, and it may suggest the cause of the injury also. If it's in a certain location, they might say they fell down the stairs, but in fact, they have this bad, bruising going on around their neck. So obviously speaking, it was not falling down the stairs. A common location of non-accidental injuries. I think you jumped one. Okay. It's in the book. Are the face and the neck. That's a common location of a non-accidental injury. We move on. Sorry about that. The other way, yes. To go burns. Okay. They result from a tissue exposed to heat above 50 degrees Celsius. Now, they're categorized by the surface area that are affected and how deep the damage is. Now, this is what's important. Persons over the age of 65 have doubled the national death rate due to burns. When you're 75 and over, it's triple, and 85 or over quadruple. So what happens is when you're aging, the burn is far more likely to cause such damage to you that it causes you to die as you age. For an older person, a younger person, it has to do with the recovery of the body, the effect on the body, etc. Obviously, it also depends on the location of the burn and the degree of the burn. Fractures occur when an external force is greater than that strength of the bone that is applied to you. So you're often would be hit by somebody or hit by something. Older people are more susceptible to this because they often have bone diseases or injuries that from their past. I will also point out that someone who has cancer, obviously, or has had cancer, is more likely to have fractures than someone who did not have cancer or has not had cancer. And the reason I'm saying that is because cancer does affect the bone density in a major way. Common sites of these are hips and wrists. Someone being grabbed. Elderly people are at risk of spontaneous fracture also. So, this is a reality. Lacerations are the result of a blunt force characterized by the full thickness of splitting of the skin. So you've caused that, through a blunt force trauma, a hit, common in physical abuse, but it can also occur through neglect. Pressure sores. Now, this is very important. Pressure sores should not happen. This is the reality. Now, when we don't care for people properly, pressure sores do occur. When it says here the standard of care for pressure sores is prevention, I can't emphasize that enough. So when somebody is in, let's say, they're in a bed, and let's say they soil themselves, and then they're not cleaned or not cleaned quickly, and then on top of it, they're in a bed and they're not moved, so they're staying in one spot for hours and hours and hours. They're not being moved. They will have a pressure sore. And then sometimes that pressure sore will get deeply infected. And sometimes that pressure sore results in death. Pressure sores are very, very, very painful. So what happens is we'll often get calls from people, and they'll be talking about this because the doctors will be suggesting, oh, your father's had pressure sores twice before, and this is his third pressure sore. So we suggest what we do is we just give him painkillers. That's all we do. And of course, the infection is going to kill him anyway. And we're listening to this, and my first response is, why does your father have a pressure sore? And why is it the third time? It's the reality. They should not be having pressure sores. It means that we're not properly caring for people. It's about abandoning them and not caring for them. And I know it takes time to care for people. I get it. I'm not, being, pie in the sky. What I'm saying is pressure sores should never happen because of the how terrible they are, and the fact of it is they're completely preventable. We move on. Restraints. Well, there are countries in the world that have outlawed restraints. Canada's not outlawed restraints. Thank God we don't use them as often as we once did. Restraints should be, how would you say, never used in my opinion, but some people would say, yes, but there are extreme circumstances where you have to restrain somebody. Well, it's very difficult because of what it means when you're using a restraint on someone. I think this is treating somebody like an animal when you restrain them like that. Obviously, I've talked about my dog before. My dog is a beautiful dog. She doesn't need to be restrained. And there's no need to restrain. But if you don't know my dog, you might be afraid of my dog. So it's good to have her on a leash, right? That's a different issue. But then there are people who have dogs that you better restrain that dog because that dog is brutal. Right? That dog will bite you if it ever got a chance. And those dogs probably shouldn't exist, but there are dogs like that. But do you want to treat a human like a dog? I understand I have to protect people from another person. Maybe someone has dementia and they get a little bit violent. I understand this, but we have to find other ways to deal with that. Using restraints only makes you not only usually makes the situation worse. The behavior gets worse because now we're restraining them. The frustration. Remember, it's a human being. Even if that human being has now got a certain level of dementia and is having difficulty dealing with, their emotions and their physical nature and everything else at that time, and they're having a difficulty time understanding things, nonetheless, restraining them is not the right idea. Um, anyway, as I say, there are countries that have outlawed restraints. Skin tears in sites other than the arms or legs or multiple tears, abrasions should raise suspicion. When you have skin tears, it should raise suspicion. Skin tears heal with scarring. You might see someone who's got some multiple scarring. And I mean fresh scars, then you would start becoming concerned. Remember, I'm not talking about this elder abuse because it's because we have to talk about it. We have to talk about it because it's become somewhat common, and we need to make sure that we know that we can't be silent about elder abuse because of the reality of what this means to the person who's being abused. Malnutrition is often a marker of neglect. People will often call us to talk to us about these issues because as someone's possibly nearing death, there'll be suggestions that they stop food and fluids and issues like that. And so now what happens is those people, when you stop food and fluids, now unless they're actually nearing death, like often someone's actually nearing death. I mean, they're actually nearing death. That's a different situation than if they're not nearing death and the decision is to remove food and fluids in order to cause their death, right? But then you will then have them die by dehydration as if they are removed from their food and fluid. But often this is also a sign of neglect, someone who's not eating. Now, for instance, someone in a nursing home, sometimes the staff is very busy and they might not have time to feed somebody. So this is a sad thing that happens when someone is not being properly fed because they can't properly feed themselves and they would need staff to do that. And there might be days where the staff is just too busy to do it. I'm not saying that's an excuse. I don't believe there is an excuse. Obviously, if someone is being put into an institution for care, they should be receiving that care without a question. Nonetheless, that would be the excuse that's given. I was really bothered because I got a call from a woman during COVID, and it haunts me to this day, that phone call, because she went in every day to feed her mother. She went into the nursing home every single day to feed her mother with dementia. And then COVID hit and she was denied entry to the nursing home. And 2 weeks later, her mother died of what? Malnutrition. Well, she probably died of dehydration. And she was so broken. She was so broken. So I didn't have to tell her. I didn't say anything to her that I was thinking, which is just too bad that she was in the nursing home. And I shouldn't laugh because it's still like it haunts me, that conversation. And it's my personality that makes me sort of smile a bit because I'm uncomfortable. But it was a haunting conversation. Nonetheless, this does happen. And also malnutrition comes from issues around cultural food preferences, not enough staff, improper feeding techniques. They say to someone, oh, the person had they've been regurgitating their food, so we better stop feeding them. No, you change how you fed them. You change how you fed them. Sometimes the person is going to die from cancer and they don't feed the person all that. Just well, as I said, Gloria, when someone's actually nearing death, that's a different story. Because when you're actually nearing death, what happens is your body begins to shut down, right? At a certain point, you are dying. I'm not arguing about that. I'm making the point that sometimes people are not otherwise dying, or they're not otherwise dying yet, right? Signs and symptoms of dehydration: confusion and sleepiness. The funny thing is someone might be going through dehydration, and then it's seen as, oh, well, she's dying because she's really confused and she's sleepy and the rest of it. And then they take that as a sign of the body shutting down instead of taking that as a sign of dehydration. It is still a hard thing to watch. You're absolutely correct, Gloria. It is an absolutely horrific thing to watch. I'm not. I'm one who believes that we should provide food and fluid so long as one's able to assimilate that. And people call me about it. I say to them, well, does your mother, is she still able to swallow a bit? And they say, yeah, she can still swallow it. Does she like ginger ale? What does she like? Because it doesn't matter at that point in life what you're giving them if they need a bit of fluid, because guess what? They are approaching death at some point, and if they're willing to, if they can still sip with the sippy straw and they love ginger ale, give them some ginger ale, and they don't need a lot. That's the other thing I always say to them. You don't need a lot at this point in life, but you still need fluid. They don't need a lot of fluid. They're not like me. They're not going out for a 10-kilometer, 12-kilometer run in the morning. They don't need a lot of fluid, but they need some. Risk factors for dehydration. Well, medications um, uh, react differently in the body when you're experiencing dehydration. And there's also a decreased absorption of the drug. And that's also when we were mentioning earlier about people when they get older, their bodies are more dehydrated, and therefore how would you say, it's possible that they're getting over medicated. And someone would say, yes, but they're 130 pounds, they're 5'6", whatever it is, that should be the right amount of drug. But no, they're 85 years old, and guess what? Their body's not the same anymore as someone who is 50. Now, I'm not saying the doctors don't understand that. I'm just saying some people get over medicated. People with dementia may not recognize that they are being abused. This is true. They may not report it, and they may not talk about it, and they certainly may not be believed that they do talk about it. And this is a sad reality. People with dementia need proper care, but they also need to be protected. And we move on. Self-neglect accompanies dementia and mental health problems. Victims become, they feel vulnerable, and they often, with self-neglect, it's because of their dependence. They become more dependent on others. What happens is you also lose your feeling of your own importance when you're being abused, as I say. So self-neglect sometimes becomes a result of that. So abuse or neglect often leads to depression, which in turn leads to self-neglect. Not only depression, but you feel emotionally off because of the fact that you can't believe that someone's actually who you love or who you know is actually hurting you or taking advantage of you. And we move on. Alcohol abuse. Well, 5% of older persons is probably going up. Alcohol abuse is more common in men than women, and lower levels of alcohol are required to make someone have ill effects when they're older. Financial abuse. Well, widowers in their 70s and 80s living in the community, it's considered the crime of the 21st century. Well, let me tell you, as I say, that crime has been really professionalized. So, if I was talking to you 3-4 years ago, I would have really emphasized the fact that financial abuse is primarily done by family members or friends, and that might still remain the stat, but it's really shifted in the last few years. People taking thousands and thousands of dollars from people. You might have heard of someone that's happened to, and you're thinking, isn't that terrible? They must have, how did they get so, well, let's not blame them, because the reality is the people who are doing it, they're like really slick how they're taking advantage of people. So when you hear that, let's say you're talking to a friend and they're talking about, oh, I have to go and buy some money cards. I have to buy $2,000 worth of money cards for something. You say, can you tell me about this? Like, I can't do I, because you realize that, no, you don't need $2,000 worth of money cards. Sorry, someone has got you in the process, and I'm sorry to say, I don't know, you got to be sort of strong and with these comments, because the fact of it is how strong and loving. But I mean, the point of it is that people have been taken advantage of. We move on. Donations to the Compassionate Community Care. Well, that is going to be talked about next by Kathy. Compassionate Community Care is a charity.
Thank you so much, Alex. That was great. And we'd love to do these trainings, which we happen to be doing more often and more regularly now, especially. So Alex is available for questions. If any one of you has an issue, which, we can resolve at the office line, please feel free to call us. Our office line, I'll send that in an email as well. Just a show of hands, I think I sent everyone here that's registered, if you have already registered, an email with a survey link in it. Okay, so if you got the survey, it's called Honoring Our Seniors. It's a survey that we are working on. We are just short of our goal of 500. So if you happen to be a senior citizen and you'd like to participate in our survey, it's absolutely free. It takes about 5 to 10 minutes. You could do it on the phone with you, if you like, with one of us. And we can write in your answers and keep that, submitted. This is completely confidential, so you don't have to worry about that. It's going to be synthesized and prepared into a report and then given out to our communities and shared within, across our contacts to show how can we better help seniors and have seniors age well at home. So if there's anything we can help you with at the office line, it's a 519 number. If there's anything you need that's an emergency, that's a crisis, that's an end of life matter, a euthanasia related matter, or assisted suicide, feel free to give us a call on our helpline too. That's available 24/7. That's the number there on the screen, excuse me. And that will connect you with us directly. So leave us your information, or, but you'll get someone on that line. So just please, you can email us as well. The email is on the screen, info@beingwith.org. And what's key here is that you might be that one person and that voice for that person. I just got off the line today, actually, with a fellow who called us a little while ago. And what Alex said today, which is really important, key, that knowing who your power of attorney is, especially for your medical, is so important. Okay. And I really want to stress this. And this is my takeaway today. Just before this meeting tonight with you all, we had a call with a man who just happened to be in the proximity of a family because they had a third party involvement in their family, but they've known the family very long, for a while, and they had a son who didn't know that his mother was going to be euthanized, and he had to find out literally less than a week before it was going to happen. And the daughter, who's the sister of the son, had orchestrated all of this with the mother. And the son wanted to be power of attorney, but because he was living out of the country and COVID happened, there was a lot of neglect. There was probably some issues there. Long story short, this happened, and sadly, the woman passed away. She chose MAID, and I just found out tonight. So I do want to encourage you. I want to encourage you to know that there are ways to prevent this. First and foremost, watch who you choose as your power of attorney, because they're going to have a big, they'll have a lot to say and they'll have sway. And it's very difficult. Now, getting to the nitty gritties, you can be ready with that power of attorney ready by the lawyer, stamped and ready to go when she changes her mind. But, to get her to change her mind is another effort. And once, all of that movement has happened in that one direction, it's hard sometimes to reverse it because they don't know what the actual other side of the fence will look like. So just to keep that in mind, people are very sensitive. Yesterday, Alex talked about caring for our own. This is crucial. Our own are the people that are being affected now. We're getting calls from people who are part of church communities, religious organizations, people that are put in religious, like what they call institutions, Catholic centers, Christian centers, and they're getting approached with people that work internally there that actually suggest to them, hey, why don't you consider euthanasia? So it's actually out, it's absolutely unfathomable, but it's happening. So in order to prevent this, we use my story, we connect with people, we prevent it, we meet with people, and we engage with them. And thank you all for being here tonight. For those of you who can support us in this work and the effort that we do to get this information out, we appreciate your donations. They can be made for any amount, and you'll receive a tax receipt for that. And we submit that to you, and you get that at the end of the year, which means early January of 2023. If you'd like to be involved involved with us, we are starting to group and gather community care groupings of individuals that have done this training, because we see there's a real need that people want to gather together and be connected to one another. And we might actually end up having some form of session like this, shorter obviously, but where you actually do the work, you get out in the community, you volunteer, and then we can reconnect with us and we can talk about it. And you can actually convey your experiences with one another and have a support system. Because as we see, when people are connected, they do more. And, you know, there's a sense of interconnectedness that we need to establish with those people we meet with. But there's also a play that happens that's beautiful, that's on these seminars, because you all have a gift that you want to share with the community that you're in. And it's really important that you connect to, and stay connected to one another as well, to encourage one another. So thank you for being here. It's important that you're doing this work. So I really want to embolden and trust in you that you're doing something that's really greater than the average person. So don't stop here, keep going. Make the call, make the visit, show up at that home or wherever residence is that holds people that might need your visits, because they are there and they definitely need your visits. We're going to be sending a quick survey out shortly that will ask you for your feedback on tonight's session and yesterday's session. So please feel free to take advantage of that and use that to give us your feedback. The advocacy program, which Alex mentioned, is starting soon. Our first session is going to be November 10th, and this will be a new program that will encourage you to know how to be an advocate for others. And it will come with a similar type of manual, and you can get copies of it. They're already printed. And then enclosed, you'll actually have a handbook and guide as well, which is available to you. And of course, if you'd like to, feel free to participate in our survey, which we sent out in an email, and I'll get that out to you. So thank you so much, everyone. If anyone has any questions, please raise your hand or you can chat, and we'll address that as well. Okay.